today, Water and Emergency Preparedness. This is the third in our six-part webinar series on water crisis strategies for health leadership. I'm Katie Mom, and I'm the coordinator of the Water Initiative, and I'm joined at the controls by Holly Calhoun, who coordinates our Food Systems Working Group. We are with the Public Health Alliance of Southern California, a collaborative of local health departments in the region focused on multi-sector policy, systems, and environmental change to improve health and equity. Just a couple of quick housekeeping points before we get started. We are going to be opening the audio lines and keeping them open. We'd really love to hear from participants on the call during question and answer and discussion sections of the agenda. So we're really envisioning these as opportunities for a learning community where you can, not just learn from our expert panelists, but also from each other working out in communities. So while we do want to hear from you during the discussion, we also recognize background noise can be distracting to others, so please go ahead and mute yourself when you're not speaking, particularly during the presentation. If you joined via computer, you'll need a microphone to speak into the audio, and you can also join by telephone by entering an audio pin. And so if you have any issues or any questions, please go ahead and send us a question, and we can respond to you using the questions box with any issues. And during the presentations, you can raise your hand if you'd like to be called on, or if you prefer, you can submit questions for the panelists using the questions box throughout the presentation. I wanted to let everyone know that we are recording today's webinar, and we'll post the recording and the presentation slides, as well as some of the reference material that will be coming up during the webinar on our website. You're welcome to share that link with others who are unable to join today. And if at any time you experience technical difficulties, feel free to send us a question, or you can contact GoToWebinar. So I just wanted to introduce our moderator today, Susan Harrington. She is the director of the Department of Public Health in Riverside County, which is really known for its innovation and cross-sector work, as well as its food systems work. Susan's been a co-chair of the Alliance's Leadership Council along with Cheryl Barrett, and it's been just a wonderful support and resource during this series. So Susan, I just wanted to go ahead and turn it over to you.
Thank you, Katie. Welcome, everyone. Thank you for joining us today. Today, we will be exploring how we can better prepare for and respond to the range of water-related emergencies that are anticipated to increase in frequency and intensity, and will come away with concrete tools and data sets to support this goal. Drought is already having severe impacts in some California communities, such as in Tulare County. With climate change projections, we can expect worsening conditions in the future that require emergency preparedness planning now. On today's call, we are going to hear from Tulare County, a county on the front line of drought-impacted California. We will hear about their response to the impacts of drought on public health, and we'll learn from their experience to inform emergency preparedness. While many of our counties are more fortunate at this point, we need to prepare effectively so that we can respond strategically. To be prepared, we clearly need to understand where and how our communities are vulnerable to the changes in the water cycle that come with climate change, from drought to flooding and sea level rise. Following a discussion of Tulare's emergency response to the drought, we will discuss vulnerability assessments for emergency preparedness. There are two standard approaches used for the risk assessments. One is top-down modeling, which are data-driven, and the second is bottom-up, which are shaped by local knowledge of the water system and are often qualitative. Today, we'll be covering a bit of both. We will have a brief introduction to vulnerability assessments that have been conducted as part of integrated regional water management plans and look at opportunities for connecting with public health. We want to present you with some of the vulnerability assessments that have been done in other sectors and explore where a public health overlay could be helpful. We will also have the opportunity to hear about the top-down data sets and tools that will help support local health department decision-making. Today we have 3 speakers for this webinar. Our first speaker is Dave Roselle. Dave has been the Public Health Emergency Preparedness Manager for the Tulare County Health and Human Services Agency for the past 4 years. In his role, he oversees planning, training, and exercise efforts to prepare public health and the healthcare community to respond to a major disaster or emergency. Our second speaker is Lauma Willis. Lauma is a climate change specialist in the Southern California office of the California Department of Water Resources and has been with the department for more than 25 years. Previously, Ms. Willis worked for the Department of Fish and Game, the Los Angeles Regional Water Board, the Coastal Commission, and the State Water Board. Our third speaker is Dr. Esty Garrity. She is the Chief Medical Officer and Health Solutions Director at Esri, the world's leading geographic information systems software developer. Dr. Garrity is a clinician, researcher, and educator in the Division of General Medicine at UC Davis, and also has a background in government, having served as Deputy Director of the Center for Health Statistics and Informatics at the California Department of Public Health. I'll now turn the webinar back to Katie Naiman.
Great, thank you. And we'll just dive right into our first speaker, Dave Roselle in Tulare County.
All right, thank you very much. I'm very, very happy to be part of this and have an opportunity to share some of the experiences that we've had in Tulare County in hopes that you're able to take some information away back to your own communities and be prepared for some of the challenges that you might face as the drought continues to unfold. I'm going to start by giving you a little update on our local status. This information is current as of last week's weekly drought report, so this is fairly recent information. We have over 1,200 active domestic well failures here in the county currently. That's over 55% of all the failures statewide. So we have, at the moment, the lion's share of the burden. And for us, that's over 5,000 people without water. We don't have an exact number, and I'll get into some of the reasons for that as part of the presentation here. We have been in our response mode, as have many other communities around the state, for quite a while now. Our local emergency was proclaimed on February 4th, 2014. And since that time, we have been in response mode, working in some capacity or another to work to mitigate the drought. Just as a brief kind of geographical look, what you're seeing here is not the entirety of Tulare County. We have a large portion off to the east that's predominantly state and national forests and parks, but this is predominantly the inhabited area. What you'll note looking at this is of those 1,200 well failures, we currently have over half of those are concentrated in one specific area in the county, which is an area called East Porterville. It's an unincorporated area of Tulare County, and for quite a while was the primary, nearly sole focus of our response efforts. Since then, we've, as you can see on the map, seen many additional well failures throughout the entirety of the county. And I think the graphic is fairly striking when you look at it to see the breadth of area that is affected. We have failures both in unincorporated areas and then also within the cities in our communities here. So we've used a number of methods to gather some information on how many well failures we have, on the conditions that we're facing. Particularly early on, we used a lot of citizen reporting, and we continue to rely heavily on citizen reporting. We've since streamlined our system to allow citizens to report well failures online on our drought webpage through our county webpage. We have consolidated a lot of our drought information through our United Way 211 line, and I'll talk about this again later, but I'll say that we've experienced great success using the 211 line as a consolidated clearinghouse for all drought-related reporting and information. It's become a very easy way for our partners, our community partners and other agencies to quickly point folks toward a place to report their drought affected conditions and also to receive information as to what kind of programs and services they might be able to take advantage of. We've also, of course, had a lot of just calls and in-person reporting. Particularly early on, calls were coming into a variety of agencies between our Office of Emergency Services, our environmental health folks. We had community partners who provide community services who would receive reports or information about well failures. And we've since, again, consolidated that predominantly through our 211 line. Also, early on in the efforts, we conducted a major community survey when it became clear that the East Porterville area was being disproportionately affected by well failures, where we did a significant door-to-door survey in the community to determine number of persons in the household, whether they were on the well system, whether their well had failed, and just to gather some information to sort of put a scope and scale on the emergency that we were facing. A lot of, again, information also comes from our community partners, nonprofit organizations, community volunteers, and other folks that have been working with us closely throughout our response efforts. We have run into a number of hurdles in that information gathering process that I feel are worth noting. First one was, of course, language barriers. We have a fairly large Hispanic population here, a very large Spanish-speaking population, and a fair percentage of those folks have a very limited English proficiency. So we've needed to ensure that we have information available in appropriate languages as well as appropriate interpretation services for people that need to be able to get information that may not necessarily speak English well, if at all. Particularly early on, we were dogged by a number of false rumors that came up as part of our information gathering efforts. There was incorrect information out there in the community that if you reported that you had no water in your well, that we would evict you from your home, or that we would red tag your house as unsafe and unlivable. Those rumors were not true, but we had to spend a good amount of time countering that information. There were also rumors that if you had children and you reported that your well was out, that we would be sending child protective services potentially to take the children away because they were living in an unsafe household. So once again, required persistence and a unity of message from both ourselves and our partner agencies that we would not in fact come and take these actions against you if you were to report well failures. Additionally, I guess sort of bundled up in the false rumors, but also of genuine concern to many people, was citizenship status. We do have, as a large agricultural community, we do have a population of undocumented illegal aliens, essentially, and the question became, if I had individuals who were not U.S. citizens living in my home, and that was discovered in the course of reporting well failures, would there be negative repercussions from that? So there was a fear there from many folks that prevented them from wanting to report. We also have some individuals that just generally have a mistrust of government and don't want to provide that information to the government, or really in any way interact with the government, even if it could potentially provide them some assistance. And we also know that we have some underreporting. We have individuals out in the community that are financially well off enough to basically be able to deal with the problem themselves, or to otherwise feel that they want to just deal with this themselves. So we know that the actual number of well failures is greater, and we don't really know how much greater. But we do know that the number that we have of reported well failures does not reflect the entirety of the problem. Community impact of the drought has been pretty significant. Obviously, we have individuals, families, and businesses without water. That number I presented on the first slide of over 1,200 active well failures is only for domestic wells. That does not include agricultural wells, which are obviously a big part of the business out here in Tulare County, as we have a tremendous production of agriculture. We've seen loss of work and reduction of working hours. A number that we track from our Workforce Investment Board reported that so far 291 of their clients have reported they've been laid off or had work hours reduced due to the drought. And again, that number does not include any number of other migrant or other farm workers that may not work through our Workforce Investment Board or other reporting sources, so the scale of the problem is not entirely known to us. We've seen agricultural impacts, which for us is big because, again, that's one of our primary industries here. We've seen a reduction in crop yields. We've seen a voluntary destruction of orchards and a voluntary fallowing of fields because farmers don't believe they have a sufficient amount of water to maintain their usual crop yields. Also, we've started to see and have had continuing consideration of some water contamination issues. As we have less water, the contaminants in the soil that might be getting into those water sources. We're seeing a higher level of contamination. That hasn't been a significant problem that we've needed to do a lot to address directly as of yet, but it's something that we keep in mind as we continue to draw down groundwater reserves. Some additional effects that we've seen, sort of secondary in some cases, spin-off effects of the fact that there's just less water and people's wells are going dry. Coming back to the agricultural industry, as they're tearing out, for instance, orchards, it creates a great deal of biomass, the dead trees that need to be disposed of. That's not an industry that is year-round active in Tulare County. Based on the typical patterns of farming, there are certain times of year that biomass disposal takes place. And it's not something that farmers can just burn, given the air quality in the Central Valley. Mass burning is not a promoted solution for that. So we've had to look at ways to dispose of that. Farmers have also reported that with those dead trees, dying plants, and those sorts of things, that those provide a host for a wide variety of pests, agricultural pests that can cause damage. We've seen citrus growers complain. John Q. Citizen has one lemon tree in his yard and opts to stop watering it because it will save on water. That tree dies, becomes a host to pests that can affect citrus trees, and those pests can come down the street to his citrus orchard and cause direct damage to his business. So we started to see, at least anecdotally, problems along those lines. We're also continuing to monitor the potential health impacts. We've seen the possible increase of West Nile virus as water sources are now naturally closer to places where humans are habitating, and they are generally smaller water sources. So we're seeing a potential increase in some West Nile virus. We're tracking the numbers to see if that's going to pan out. And additionally, with increased dryness and increased dust, we're looking at possibility of a higher level of respiratory illnesses. One of the other problems we're seeing, there's actually been a few newspaper articles on it in the past couple of weeks, is the issue of subsidence, which is as we pull more and more groundwater out of the ground, those pockets, those spongy pockets of earth have started to collapse and settle. And we're seeing parts of the Central Valley that are settling at the rate of several inches each month. So the ground is literally lower than it used to be, which could potentially cause damage to underground infrastructure, pipes, and that sort of thing. Is something we need to monitor. I can't point to any specific incident that we've had that's been a particular problem, but it's something, again, that we continue to monitor to see if that's going to evolve into a significant problem. From our perspective, on the side of being the government of the responders to the drought and our community partners, we've seen a significant additional administrative burden. The processing, tracking, and administering of drought programs and the associated funds is in its own a full-time job. We've additionally seen a massive uptick in the issuing of well drilling permits by our environmental health group who issue those permits. In 2014, they issued twice as many permits as they had in all of 2013, and as of currently now in 2015, we are on track to double that number again. What we have seen out of this is we've had to allocate new staff positions essentially dedicated to drought activities full-time. In our Office of Emergency Services, which is our primary agency leading our drought response, we'll be adding 3 additional staff to help cover some of those duties. Our Resource Management Agency and Environmental Health have been adding staff members specifically to monitor and administer some of the programs, as well as our nonprofit partner agencies. We've heard from them that they're adding staff also to help with their program administration. So some of the mitigations that we're working on, obviously we recognize that really the only true permanent solution is going to be rain. We are exploring expansion of some of the city water systems into areas that are currently primarily reliant on wells, but we recognize that it takes time, money, and political will to extend that infrastructure, and we know that the city water systems are also not inexhaustible. So we're doing that where we can. It's not always our primary solution, though. We have several programs here that I will expand upon in the next several slides, just to give you an idea of some of the other things that we're trying to do to mitigate the issue. Our bottled drinking water program involves a home delivery of bottled drinking water at the rate of 64 ounces per person per day to affected households. That program does have a household income limit at 80% of the California median income, and there are over 1,000 households that are currently participating in receiving that bottled drinking water. Our household tank program is a mitigation where we're installing 2,500-gallon potable water tanks that are tied directly into the home plumbing system. We have over 250 of those tanks already installed and another 35 or so that are being installed weekly. Those tanks are refilled on a bi-weekly basis with the target of giving 50 gallons of water per person per day made available to that household. We're also performing some comfort efforts within the community where we're trying to have non-potable community water tanks available, so you can go and fill up a bucket or barrel and use that for non-potable uses such as flushing toilets. We've also made in the East Porterville area, again, that hardest hit section of the community, we've made community showers available to individuals who may not have running water in their home and have that as a comfort effort. Additionally, we've started to build a policy out for a relocation program. It will be an entirely voluntary program. We are not going to force anyone to leave their home. It comes from the governor's executive order budgeting $6 million to help support that. And the state is helping draft some of those guidelines and has been working with our local drought task force to develop a local program. At the base level, we anticipate it'll be relocation expenses plus about 12 months of rent differential for qualified households. But that program is still in development, and we'll see how many people take advantage of that. To give you just a very brief look at our coordinated response here, our Office of Emergency Services is our lead agency for our drought response, and they, through the Drought Task Force, have brought together a wide variety of groups, including government. That's our Health and Human Services Agency, of which I'm a part, our Resource Management Agency, our County Administrative Office, and a variety of other offices. Obviously, the incorporated cities within our county, various special districts, nonprofit organizations, community volunteers, and we've had tremendous partnership from several different state agencies in the state of California to help us mitigate some of our efforts here. The big things that we've really taken away so far is to share the burden of the response. Engaging our nonprofits and community partners has been tremendous, in some part because emergency funding is made available to us, is a higher reimbursement rate to nonprofits. So if they install the water tank, they receive a higher rate of reimbursement than we do if we use government employees to install one of those potable water tanks. Centralize your reporting as soon as possible, using that United Way 211 information line, which previously had been established and is still in use for folks that need help paying their utilities or finding other safety net programs, is now our central reporting area for all drought-related information. So we've found that that's been a tremendous benefit. It helps deduplicate and centralize our information. Build trust with the community and partner organizations and agencies. We've been able to leverage agencies that already are trusted within the community, and they've been tremendous partners for us in helping to go out and get into the community and basically build bridges with folks that we can provide assistance to. And as you saw with some of the agricultural issues that we've been facing, be prepared for cascading problems, and you may need to do some innovative problem solving. You may be looking at grants from multiple sources all coming together to help make a single project go forward. And there's a lot of detail that needs to be managed, a lot of information that needs to be tracked. It's been very daunting, but it's been very enlightening as we've had to respond to the drought so far. I'll put my contact information up here. Please feel free to reach out to me if you have any additional questions, and I'll certainly remain on the line for the question session that we may have at the end here. But in the meantime, in the interest of time and respect for other presenters, I will turn things back over to our hosts for the day.
Great. Thank you so much, Dave, for sharing that. Sounds like a really heroic effort to address the many unanticipated as well as anticipated effects of the drought there. It's just amazing to hear. Dave, I will ask you just one quick question from the audience before we move on, and wanted to give our audience a heads up that I'm going to be asking a couple of quick poll questions here as well. So one of our audience members asked, do you have requests to drill residential wells within the service area of a water district due to water becoming more expensive? And just quickly, if so, how are you handling that?
So one more time, the question being, do we have requests to drill residential wells?
Yeah, within the service area of a water district because of water becoming more expensive.
That's a good question. I don't have that information at my fingertips, but that's something that I will look up and can provide back to you. I'll check in with our folks that are tracking that.
Great, thanks, and then we can get that back out to the audience. That sounds great. Well, thanks again, and we're going to shift on more squarely into emergency preparedness. We're going to talk about vulnerability assessments, and just before we hear from Lama Willis, just a couple of quick polls for our audience members, and we're going to just put these up quite quickly, keep things moving. But just wanting to get a sense of how many of your jurisdictions have conducted a risk assessment that includes anticipated climate and water changes. So if you could just take a moment, we'll give about 20 seconds for you to answer this. Has your jurisdiction conducted a risk assessment that includes anticipated climate and water changes? Okay, just 5 more seconds. Okay, great. Now let's just take a look at our results here. Oh good, so a quarter of people on this call have conducted risk assessments. About half haven't, and 30% aren't sure. Okay. Well, let's hold that in mind as we go forward. And then a quick second poll. Do you have an emergency response plan in place for high-risk climate and water events in your jurisdiction? So whether it be drought, flooding, sea level rise, does your jurisdiction have an emergency response plan in place for the high-risk events and vulnerabilities in your area? So just 10 more seconds. Okay, great. And now let's go ahead and pull up the results there. Wow, so almost half of the jurisdictions on this call do have an emergency response plan in place. Yeah, that's great. So it would be wonderful in our discussion period to hear from some of you who have been dealing with this about what's worked well for you or some of the lessons that you've learned. So please keep that in mind, that we would love to hear from you. And we'll just go ahead and turn the floor over to Lauma Willis, who's with us from the Department of Water Resources, to talk to us a little bit about the vulnerability assessments that have been done as part of the integrated regional water management planning processes. Lauma, I'll just hand it over to you and invite you to take yourself off mute.
Well, thank you very much. And thank you, everybody, for allowing me this opportunity to talk about climate, water, and finding the connections with public health. If you go to the next slide, we all know that one of the key critical issues that we're facing are the extremes that we're experiencing now and projected into the future with heat, drought, and rain. And just for those online in the webinar, the upper left actually shows a study done by UCLA about current and projected temperature extremes for the LA County area. And you'll notice that we're seeing a lot of days, heat days occurring, and we're projected to have more. And that exacerbates the current drought. The figure down below on the left, that was just from last week. The darker the colors, the more extreme the drought is that we're experiencing. And as the previous speaker had mentioned, one solution to get out of the drought is to have a rain. And off to the right is a figure from 2004 where we have an El Nino, and not all the El Ninos bring in the sufficient amount of water that we need. But if you look in the box, that's an atmospheric river that's heading to California. And those are the ones that bring the majority of our water supply into California. Of course, with extreme drought, the other end, we have extreme flooding. So those are two issues that we need to consider when preparing for disasters. Going to the next slide, the state has prepared a lot of different documents out there available online from the California Water Plan and California Flood Futures. That's within the purview of the California Department of Water Resources. The Office of Emergency Services has a 4-volume adaptation planning guide that also includes identifying strategies to cope with these changes that we're currently experiencing. Our Office of Emergency Health Hazard Assessments already has come out with a climate change indicator, a book that's available for anybody to look at to see what are some of the indicators that show changes are occurring. And our most current adaptation planning guide for California is Safeguarding California, Reducing Climate Risk in all facets of water, public health, and elsewhere. So that's something that is out there, and all we need to do is go and find those resources. But it's not enough to just have those publications. If you look back into the bond funding of a few years ago, and next slide, you'll see that the Californians have voted in a variety of bonds, Proposition 84 from 2006, and most recently Proposition 1 from last year, where a lot of money is being made available for local communities to improve their structures, particularly water infrastructure projects. And if you look at that slide, you'll notice that $580 million specifically was earmarked for sustainability and climate change from Proposition 84. And even with the current bond funding from Proposition 1 that's hitting the streets now, there's an emphasis on adapting to climate change. But going back to Proposition 84, that's probably the first time any of our bond measures have indicated that we need to address climate change. And how do we go about doing that? Well, going to the next slide, one process is incorporating it into what we call integrated regional water management. And that's been around for quite a while from Proposition 50 bond funding. And it's a collaborative effort to identify and implement water management solutions on a regional scale in order to increase the regional self-reliance, as well as to reduce the conflict associated with applying for monies. Funds are limited, and if you're competing with other folks, only a few communities will be able to get those funds. By integrating your process to include a variety of other stakeholders, not just water agencies, but public health agencies, local cities and counties, you're able to tap into more of that bond funding and bring something more locally available. And as you notice in the diagram, right now we have 87% of the geographic area of California being covered by these regional water management groups, and that constitutes about 99% of the state's population. And these cities, counties, water districts, community groups, and others across the state are working together to organize and establish these regional water management groups. Now, if you think about Prop 84, there was mention of integrating climate change. Part of that resulted in developing plans for these integrated regional water management groups. And in developing those plans, the key component was to incorporate climate change, which you'll see in the next slide. And part of that process, the Department of Water Resources, together with the U.S. Environmental Protection Agency and the Resources Legacy Fund, developed a handbook for regional water planning. And it outlined the general process for accounting for climate change in water planning, emphasizing the available literature that existed back in 2011, and was intended to support the overall IRWM planning effort occurring in California. To go to the next slide.
I wanted to give you a heads up. There's just a couple of minutes left.
Pardon?
Just a couple of minutes left.
Oh, okay. And part of that is in that handbook talks about climate change analyses, and this process was new for a lot of the IRWM practitioners, and these are the steps most analyses will undertake. And the first one is assessing your vulnerability. And what does that mean? Well, going to the next slide, we have all plans must address, according to the bond funding and the funding associated with the Department of Water Resources, a regional climate change vulnerability assessment, prioritization of those vulnerabilities, and a plan for gathering data and analyzing those vulnerabilities. So going into the climate change vulnerability assessment, on the next slide, you'll see that that particular handbook provides several methods for assessing those vulnerabilities, and there is an extensive checklist of qualitative metrics that highlight those vulnerabilities. Looking at currently observable climate change impacts, or what we call climate sensitivity, looking at the presence of particularly sensitive features, such as flood control infrastructure, your internal exposure, and also the resiliency of a region's resources, adaptive capacity. And in the next slide is an example of a checklist that we have through the Santa Ana Watershed project in their update of their IRWM plan. And in that checklist includes water demand, water supply, water quality, sea level rise, flooding, vulnerabilities for ecosystems and habitats, and hydropower. And what you see is an example of a subset of water quality. All of these have been developed for the current regional water management groups that exist in Southern California, as well as throughout the state, and they're available for anybody to review. As you see in the next slide, some more information about our own program, as well as the Integrated Regional Water Management Program.
Great, thank you, Lama, so much. That's really wonderful. And just so everybody knows, these vulnerability assessments, which are contained within the Integrated Regional Water Management Plans, those are available, and we'll be sending out links, thanks to Lama, to all the integrated plans in the Southern California region. So there'll be a link to that in the follow-up email from this webinar, so please keep an eye out for that. And if you haven't already connected with your Integrated Regional Water Management Group, that would be a great way to get connected. And also just to point out that those plans do mandatorily have a chapter on disadvantaged communities. So there's one great connection point for health departments as well. So thank you so much, Lauma, and hopefully, if you could stay on and be available for questions. And then if anyone does have any follow-up questions or need help connecting to their groups, are you available to support that?
Oh, yes, I'm available. My
Great.
address currently is lauma.yurkovitz@water.ca.gov.
Great, thanks. And if it's okay with you, we can go ahead and send out your email address to everybody as well.
Okay.
Okay, great. Well, thanks again. And we'll just shift gears here again and hear from Dr. Esty Garrity with ESRI with some kind of top-down or data-oriented tools to support with vulnerability assessments. So why don't you take it away, Dr. Garrity? Thanks for being with us.
Great. It's my pleasure. Thank you. The biggest first challenge will be ensuring that I'm sharing my screen.
It's working.
So let's see what happens. All right. Okay. Are you seeing the full screen then?
Yes.
Perfect. So I'm just so happy to be here and share with you some tools and data that you can use to better understand climate change and mitigate its health impacts, and especially with regard to our water emergency in California. Now, let me first introduce you to ESRI in case you're not familiar. We're a 46-year-old global company, and we develop geographic information systems software. And our mission really is to enable geography as a language that helps our users to address complex problems and challenges in ways that make the world a better place. And certainly climate change and its impacts on human health fit that notion of a complex problem that needs to be addressed. Now, as you well know, the impacts of climate change on human health cover this wide spectrum of pathways. Some of them are direct, like severe weather and heat stress causing injuries, heat exhaustion, cardiovascular failure, or even death, while others are more indirect, like drought, leading to food insecurity, which can result in many things like malnutrition and mental stress. So how can a GIS help with this? Well, first, it's a great tool for integrating many kinds of data, everything from Landsat images and environmentally sensed data to healthcare and public health resources, as well as demographic information and more. We see geography as the glue that links these disparate data sets by their common geography, which allows us to start analyzing them, visualizing them, and detecting patterns. This then drives informed action. And since we know that geographic information is found in 80 to 90% of all data resources, location as a data interoperability method makes a lot of sense. So let me show you some examples of this idea at work. So here are some of the things that we know governments are doing with GIS. They're monitoring and predicting with their data, thinking about things like flooding and the economic and health impacts associated with that. They're planning and designing the communities that they live, work, and play in. They're managing and taking action, setting up common operating pictures in the face of disasters. And they're collaborating and communicating with their communities and their stakeholders. Ultimately, government agencies are delivering value by improving the efficiency in their organizations, enhancing communication through a common mapping platform, and taking advantage of more informed decision-making. Perhaps something like we see in this video. Here I'm showing that one can predict which cities will have similar heat indices to other cities. In 2040, for example, St. Louis may have a similar heat profile to Las Vegas. So St. Louis leadership might consider making capital investments to assist in adaptation to this new environment, like ensuring that all new housing structures have air conditioning. In this animation, we can focus on St. Louis and predict what happens to the population when we look at numbers of heat days over 90 degrees or 100 degrees in a year. Planners and responders can use the Social Vulnerability Index to hone in on the most susceptible populations and target their interventions strategically. You can see the increasing value of the data when we include relevant tables, charts, and other kinds of infographics that can then impact our decisions. In this case, we can use the census information to look at sea level rise and the population that might be impacted. Along the Atlantic Ocean, we can see how many people will be displaced given a 1 meter sea level rise. If we zoom into New York, which I think we're going to do in a second here, the bottom screen shows that 770,000 of the population could be displaced with just that 1 meter of sea level rise. So I just have you stop and notice for a moment how you can tell a story very quickly with a GIS. This demo shows what could happen in Gloucester when there's flooding as a result of a hurricane. Several different kinds of data layers can be explored on the map, like streets that are impacted, all of the flooded structures, and the kinds of populations at risk, like low-income individuals or elderly people who may need additional kinds of help and resources. This is very practical and actionable information. And depending on the needs, we can get much more technical, like taking Landsat information that we as a company load every night into the Amazon cloud and make available to show change analysis. So it's not just showing pictures, but we can do on-demand analytics, showing things like NDVI measures, soil measures, and other kinds of interpretive measures. Important data sets can now be in the hands of local governments to support their missions and their programs. Now, you may be getting the idea that maps are a great way to tell a story. Well, we've actually designed templates that anyone can use called story map templates. Now, this is one, as it comes up, that I think communicates to a lay public the overall seriousness of the drought. Now, hopefully it will come up because it's a really good one. Okay, so here, when we look in the lower right-hand corner, we can see the U.S. Drought Monitor from a year ago. And the zoomed-in map on the left side is showing a few Southern California counties and their reservoirs. As we click through the next pages and see each of these reservoirs, we can really get a greater sense and appreciation of the seriousness of the drought. I really found this particular story map to be truly impactful. All right. Now this story map is just a single page map that compares the U.S. Drought Monitor data in 2012 versus 2014. And I know it'll come up in just a moment. And what you're going to see is a slider bar so that you can start to really examine the data more carefully and see the extent of change over a 2-year period, especially California and Nevada. So here we go, and we've got this slider bar that shows you what's going on. Well, I guess 2014 didn't show up, but as you all know, it's a much more serious condition in 2014. All right, now I really like this next example because Cal OES has used one of the story map templates to create an executive briefing book. Now, due to some agreements, I can't show you the interactive version, but I've put together a number of screenshots that are going to show you how our state has put together some important information. You'll probably recognize this first map. It just clips that U.S. Drought Monitor data to the California state boundaries. Now, on the left of a story map, you have narrative information. In this case, there's even a table of contents, so you could hyperlink to the information most relevant to you. The California Executive Briefing begins with a review of reservoir conditions across the state, with blue dots being normal conditions, and then yellow, orange, and red dots showing increasingly abnormal or low conditions. When you click on any dot, you're going to get additional information like elevation, capacity, and the current average and historic storage, even the storage change, as well as outflow and inflow data. There are even links to the data sources used to create the map. The next chapter focuses on local requests for granting of funds for drinking water shortages and contamination issues that are associated with or exacerbated by the drought. Those funds can be used to pursue a number of solutions, like the ones that Dave mentioned, things like interim bottled water, interconnecting with other water systems, developing new sources of water, or expanding those existing resources. There's also funding available through the California Disaster Assistance Act, and this map is showing where those dollars have been approved. I wanted to give you an example of the pop-up boxes associated with each feature on the map. Here we can see Tulare County has approved funding for nearly $3 million. I'll note that when you use story maps, you're actually using an online dynamic tool. So when you update your source data, the map and the pop-up boxes update automatically, which is going to really save you time and money. Now in this map, you're seeing different kinds of local entities, like cities, counties, tribes, and special districts that are making proclamations of the existence of local drought emergencies in their jurisdictions. We can also see where some of these entities have set up special task forces to deal with the issues. And this page of the briefing book shows the areas of historical and recent subsidence across the state and provides links to special reports on subsidence from a few different kinds of entities. Now, you're all probably more familiar with this issue than I am, but I did just hear on NPR last week that there are areas in the state that have measurable subsidence on a daily basis, which I thought was pretty scary. The last 2 pages of the drought briefing book look at other impacts of drought. Now, this one looks at unemployment rate data from the Employment Development Department. But to supplement that, the University of California, Davis, my alma mater, so I'm very proud, published a new report that found in 2015 alone, the drought will cost state farmers industry $2.7 billion, more than 18,000 jobs, and 564,000 acres fallowed. And these numbers represent a big increase from the 2014 figures. And this final page hones in on the specific agricultural industries by comparing economic values for fruit and nut, field crops, vegetable crops, and livestock between 2013 and 2011. The drop for Fresno County alone is over $468 million. Briefing reports, such as this one that Cal OES developed, give you a lot of great information that can be quickly absorbed and used for a number of different response strategies. So I've shown you a few different things here, like different kinds of data assets that can be leveraged to better understand climate and especially drought issues. We've looked at different kinds of visualization and on-demand analysis, as well as ways to communicate with populations and stakeholders. I would say the uses of geographic information systems are countless, and actually, for me, even that notion can be daunting. So I just wanted to spend the last few seconds showing you some good resources that you can use pretty quickly and easily. Now, I know that you're very busy people, and you absolutely do not have to reinvent the wheel. Esri has a number of vertical sectors that can help you with climate change and drought response. The first one I wanted to point out is our solutions for water utilities. Now, I'm going to caveat this by saying that the focus of this group is on the utility companies themselves. Nevertheless, there are a number of solutions, which, by the way, are often free templates that come with our basic software tools that you may already own, and they're easily configured to your needs. So don't exclude the water utilities group. They even have a template for respond to emergencies as an example. And I wanted to let you know that this group has a 4-part technical webinar series called Save Water with ArcGIS. It's free, and it actually begins tomorrow. You can participate in the group by looking up the Esri Water Group on meetup.com. You might also want to review the solutions available in our public safety sector. They partnered with Cal OES on that executive briefing book that I showed you, and they're experts in any kind of emergency response efforts. And perhaps one of the most relevant resources that I can show you is on our Resilient Communities website. This landing page address is a little longer, so the easiest way to find it is going to be to type in Esri Resilient Communities in your search engine, and it'll come right to the top of the list. There are so many resources here that I wanted to quickly walk you through where to find them. One of the things you'll notice is that we had a Human Health and Climate Resilience App Challenge. We're actually going to announce the winners of that challenge next week. But importantly, all of the creative and innovative applications that people submitted for the challenge are going to be on our resources page for anyone to use. As you navigate down this landing page to the Health and Human Services section, there is a collaborative resource portal. Now, when you go to this portal, you can browse the gallery and particularly look at the Climate Resilience Gallery for some important data sets and maps that you can use right away. So we have severe weather public information maps, cooling needs, and FEMA flood insurance zones. You can review sea level rise and coastal flooding impacts and data from NOAA's National Climatic Data Center. There's a lot of stuff here. And if I just go back and show you the other part is the Health and Climate Open Data. This is all ready to use now. You can use it in any way that you want. We have data categorized under health data, environmental quality data, or air quality, or you can look by agency, the CDC, HHS, EPA, and NOAA. You can actually start gaining valuable insights with this stuff today. And so I've collected some specific story maps that provide valuable information that I didn't have time to share, and I'll send all of the links to the things I did show you to our organizers and hosts so that you can play with them and gain insight immediately. And I'll end with that and just thank you very much for your attention.
Great. Thank you so much, Dr. Gary. That was really wonderful and so many great resources there. Just in the last few minutes of our hour, I just want to open up the floor to everybody on the call. It would be wonderful to hear from you, either sharing your best practices and lessons learned from your work in this area. I know there's a lot of wisdom in the room. And also just really focus our attention on some of the actions that local health departments can be taking in this area. So I just want to share a little summary here of some of the actions that were discussed on the call today. There are obviously a couple of other ones. For example, I think that Dr. Garrity really emphasized taking advantage of some of the free data and templates that are available as part of a data collection process. That's really important. We also heard from Dave Roselle the importance of data management and centralized reporting. But here again are just a list of some actions we pulled together. So becoming familiar with some of the assessments that are already done, already completed, or are being done in your jurisdiction. Really introducing yourselves and building relationships with water planning partners, such as the integrated regional water management groups. And again, specifically, how can we as local health departments assist these chapters with disadvantaged communities? Actively building these partnerships to ensure the whole system's working together, projecting anticipated health impacts using available data and tools, developing health response objectives and an action plan, and actively communicating those to partners. And finally, starting to introduce more upstream resilience strategies. And some of you on the call today have been participating in our environmental health webinar, so there are a lot of connections with alternative water infrastructure. So most people should have control of your audio. Invite you to raise your hand and speak, or type in questions here for any of our speakers, or just to share your reflections or experience with everybody on the phone today. Great. So it doesn't seem like there are any questions coming in just yet. So just wanted to just maybe focus a minute here on disadvantaged communities. We didn't get so much of a chance to dive into that, but I wanted to invite any of our speakers, especially you, Dave. You'd mentioned disadvantaged communities in your area and working with them, and Lauma, you as well had emphasized the chapter on disadvantaged communities in integrated regional water management plans. So I don't know if you want to expand a little bit on actions that you would encourage to address those vulnerabilities in the context of water preparedness. Do you want to chime on that?
This is Lauma. The regional water management groups have been integrally involved with local communities, identifying where these disadvantaged communities are occurring and pulling together projects that will benefit those communities. It's part of a requirement for Proposition 84 and part of the IRWM planning process that had recently occurred. So that information is available online with each region's planning document for anybody interested. And I think this is a great opportunity for public health officials to connect with these water management groups to see what kind of information they can share with these groups and how best to direct these limited resources through bond funding towards those communities that are most vulnerable.
Right. Great, Lama. And there's a follow-on question from our one of our audience members. Could you just talk a little bit about what actions could be taken either locally or by the state to prevent overdrafting of groundwater as a maladaptive response to the drought? Obviously, we've heard about overdrafting of groundwater throughout the state. Yeah.
Well, currently, the department and other agencies throughout the state are monitoring the levels of water. So they're collecting that information to get an idea of what's occurring. A lot of times we don't have that information because many of those wells are privately owned, and that information is really kept between local agencies and the person or entity that owns the well. But for publicly owned wells, we do go out and monitor those levels. There are grant funding to address groundwater issues, and currently workshops are occurring. I would say go to our website to look at the documents we have there. We've developed a draft groundwater management plan available for review.
Sorry to interrupt you. I just wanted to hand over to Susan Harrington to wrap us up, and we will send the link to that website that you mentioned out to our audience to get more information. So Susan, could I just ask you to take a moment to wrap us up?
Yes, I want to thank each of our speakers, Dave Roselle, Lauma Willis, and Dr. Estee Garrity, and all of our participants who joined us today. I'd like to remind you that this is an ongoing series for water, a critical public health issue. And we have several dates coming up, as you can see here, September 30th, October 28th, and November 18th, and we hope that you will join us. If there are any questions, we'd like for you to go ahead and contact Katie Maiman for more information. And as she said, we will be having these slideshows and additional resources available to those who have participated today and others that might be interested on our Public Health Alliance of Southern California website.
Great. Thank you so much, Susan, and to everyone for joining. And again, we will be following up. And lastly, I just encourage you to please take a moment to fill out the survey that will pop up on your screen after the webinar. Thanks again to everybody. Bye.